Welcome back to Bayou Time. I'm joined here by Dr. Craig Walker, and glad to have you here again. And earlier we were talking about the artery side of things, but I think you have some more topics to discuss on circulation in the vein side.
Sure. What we have is arteries carry blood to the legs, and so when they become plugged up, we have pain with walking in the muscles, or we have ulcers like I showed, or gangrene. Now on the venous side, the veins are returning blood to the heart. And if there's a problem on the vein side, the most common sign of that is leg swelling. So particularly leg swelling that is worse late in the afternoon. In other words, there's not a lot of swelling in the morning when you wake up, but after you've been on your feet for a while, the legs swell and they hurt. And that's because of impaired venous return. And it has a lot to do with gravity. The heart, when it pumps into the arteries with a lot of pressure. The veins don't have a lot of pressure. So only three things really get blood back to the heart against gravity. First off, there's a little bit of pressure left from pushing from behind from the arteries. That's called visa turgo, which means push from behind. Secondly, when we take in a deep breath, we suck the blood up. But for the most part, the calf pumps, the muscles pump, and they inch blood up inch by inch, and there's a series of valves that stop the blood until it gets to where it can get back to the heart. So if I can see the first slide, on the vein side, there's a classification which is called the CEAP classification. Now when people think of venous problems, they think always of just big venous varicosities. And yet there are things much worse than venous varicosities where you may not even see anything. And the only symptom may be restless leg syndrome or chronic edema. So if I can go into these in more detail, if I could see the next slide. This is a CEAP 0. This is the kind of legs everybody wants, okay? And these are perfect. These are perfect veins and pretty perfect legs, certainly. I mean, this person's in great shape and the veins are doing well. Next slide, please. CEAP 1, we get these little tiny small vessels which we see under the skin. These are called telangiectasia. These are more of a cosmetic nuisance. They're not really typically associated with pain. Next slide. CEAP 2 is a varicose vein, and these look pretty bad. These can actually pop and bleed, and this is a problem. But believe it or not, this is not the worst of the CEAP classifications. Oh, yeah. So next is CEAP 3. This is a person who has persistent leg swelling. And you can see on the right, if you push with your finger, you leave an indentation here. These legs hurt, and there's a lot of great treatment. We first have to see, is it just because the valves in the veins are leaking and therefore the blood is staying in the feet? Or is there a blockage in the venous system? We treat those differently. Next slide. CEAP 4 is due to the fact that the blood pools in the legs, the blood actually starts to stain the tissues. And so you see the discoloration of the lower legs because the iron in the blood is just like putting a tattoo there. And so we have what's called CEAP 4A and B. A is when it's the dark color. B, now it's starting to score down and turn white. Next slide, please. CEAP 5 is a healed venous ulcer. And I was telling people earlier, I've seen people who've had venous ulcers for over 30 years that we found a central venous blockage, fixed it, and those people were then cured. But people who were chronically in the hospital with venous ulcers. Next, please. And CEAP 6 is an active venous ulcer. And these are real patients worked on. And every one of these patients can be helped tremendously. As you might imagine, this is painful, it hurts, sure, and you certainly don't want to show these legs off in public. Next slide, please. So here we can see some of these people who've actually presented, and you can see the big venous varicosities. This is after a single treatment done with local anesthesia in the office, and you can get an idea. This patient felt a lot better about his legs. They kept popping these veins.
That's the same leg, right?
Same leg, wow. Same exact leg. Next slide. And by the way, just a week or so later. So what are these symptoms here? They're different. Leg swelling. You can have burning or itching of the skin. A lot of these people have simply restless leg syndrome, very common. They have skin discoloration. They just don't feel right. And what has amazed me with this is that people who present with this kind of venous insufficiency, when you treat them, they can actually walk further and run better, because what happens is the veins are draining all the toxins that we produce back to the liver so that they can be detoxified. Well, what happens is, if you don't drain the legs, and when you run, you build up lactic acid, it hurts, so you can't walk. So I've actually had to work on young people as young as 14 years old who were great athletes who had blockages that we had to open up the venous blockage. Wow. So we do have another slide, I think, after this, and it's really part of why I'd wanted to come in and speak with you guys, because we're having our 16th annual New Cardiovascular Horizons meeting, May 27th through 29th at the Roosevelt Hotel in New Orleans. This has become one of the biggest peripheral vascular meetings in the whole world. Wow. We always have the people who made the first stents, the first balloons. It's really an unbelievable conference with a phenomenal group of attendees. There will be 28 live cases performed in regular sessions, live cases also performed in some of the smaller sessions, and the idea is to educate healthcare providers, but also the community about this disorder. There's so much that can be done to treat patients effectively with peripheral arterial and venous disease. Biggest problem is making the diagnosis, and we just have to increase awareness.
All right, and we only have a few seconds left, but if somebody does think that they have some of these symptoms, what should they do? What do you recommend?
Certainly, I would suggest that they see their healthcare provider, mention these symptoms, ask if they could check their pulses in their legs, or see if they're swelling. So many people who have leg swelling simply call it heart failure or other things. It's not that at all. It's that the veins are not draining the legs. Certainly, we at CIS have a real devotion to trying to treat this problem and alleviate these problems. And we could be called at CIS at 876-0300, and we would certainly be more than happy to answer any questions anyone would have.
Well, thank you, Dr. Walker. You certainly educated me about veins and arteries in this very serious condition, and I hope all the public out there, learns a lot. And if you do have this problem, that you make sure to seek professional help about it. Stay tuned. We do have TGMC's To Your Health segment. We'll be joined by Keith on the set. If you can stay tuned for more on Bayou Time.